Hello, everyone. I am very excited to be coming to you live today for Ask Miss Jai Live. Today we are going to be talking about engaging families and supporting their transgender and non-binary children. So we're going to talk about some tips on how you can engage families, especially if they are struggling with supporting their trans and non-binary children. And I'm going to give you some examples for each of those tips as well. So that way it's not just here's a general tip, but you'll get some actual language that you can use and ways that you can talk about it. So if you are checking this out live, go ahead and put a hashtag live in the chat. If you're checking it out in the replay, go ahead and put a hashtag replay. If you have other recommendations on how we can support families and engage families in supporting their trans and non-binary children, please feel free to add that in the comments as well. I'm excited for us to have this conversation. And yeah, stay tuned. And I know that this is going to be a great chat for us today. Oops, just kidding. Well, here's the chat. Here we are. I can't figure out where the navigation has changed on my end. So here we are. I'm very, very excited for our chat today. So today we are talking about engaging families and supporting their transgender and non-binary children. My name is Miss Jai. I use she, her, and he, him pronouns. I am a subject matter expert and capacity building trainer and facilitator who helps healthcare and public health agencies learn how to better serve trans and non-binary communities through capacity building training, technical assistance, and organizational strategizing. So I'm bringing some of the tips that I have based off some of the conversations that I've had over the last few years with organizations who are supporting families of trans and non-binary folks. So, and a lot of these recommendations also come from a document that's in the show notes below from SAMHSA on how to support LGBT children and help families understand supporting their LGBT children. So to kick us off with the tips and some of the ways that we will talk about this, the first thing that I'll say when we're talking about families and support and engaging families is that we have to be strengths-based in the approach that we take with families and treat families and caregivers as an ally in the health of their child. Sometimes, unfortunately, what we see in public health, in healthcare, and in environments where we're talking about gender and sexual minority young people, but especially trans and non-binary young people, there's almost this assumption that can occur where we assume that families are going to automatically reject their children or are automatically not going to be supportive of gender expansive or gender diverse children. And when we approach from that perspective, unfortunately, it's already closing the door to how we're going to be able to connect with families. So a strengths-based approach in working with families is understanding and treating families as allies in ultimately wanting the best for their children and being invested in the health and well-being of their children. And I think that some of the ways that this can look for services that we provide as in healthcare or in public health settings is approaching the health of their child, of their trans or non-binary child, as a how can we work together to ensure that your child has the best health. They're maximizing their health potential. And maybe that's not the language we would use with a family, right? Because that's more like public health speak. But how can we work together to ensure that the young person that you care about within your family and the young person that we care about within the context of our services is able to be as healthy as possible? So being strengths-based means that we are treating the family as an ally in the health of their child. And part of that is assuming that families love their children and want them to have a good life. Oftentimes, when families panic, or caregivers or parents panic, or starts to get really really scared about the future of their children's life or the future of their children's health, it's based in this fear of how folks will be treated, how their young person will be treated or their child will be treated, or fear of what this will mean for their health and how difficult their life might be. So, for example, for myself, for example, when I came out to my father, the response wasn't necessarily positive or negative, but it felt more negative just because it wasn't positive. But the response when I came out to him was just, well, there's a time and a place for everything. And then we didn't discuss it or talk about it for years. And whenever I mentioned dating, whenever I mentioned dress, whenever I mentioned gender expression, it was always to divert and move away from those conversations or to minimize those conversations and say, like, that's not the most important thing about you. The most important thing about you is that you are a scholar and an academic and you're a student and you're my child. Um, and unfortunately, in minimizing those pieces, it was hard for me to understand that a lot of that was coming out of fear. And a lot of that was coming out of a fear that folks were going to treat me poorly, that I was going to be in a situation or an environment where I was going to be hurt, or that because I was trans or non binary, I was going to experience some poor health outcome in my future, because of the ways that identities are sometimes conflated with health outcomes. And we know as public health providers, as healthcare providers, that being trans or non-binary is not the causation for why there's severe psychological distress or experiences of violence or challenges with housing or employment. We know that being transgender or non-binary is not the cause of that, but it's because of the ways that we are treated in our society as trans and non-binary people, and it's because of the ways that that treatment then impacts our willingness to get health support, get services that are preventative, etc. So we have to assume that, again, we're coming from a similar mind around this, which is that families love their children and parents and caregivers love their children and want them to have a good life. And as professionals in the field, we can be strengths based and treat them as an ally in that care by helping them to understand what's going on for their young person and how they can be supportive and how that support ultimately will impact the quality of life for their young person and their health outcomes. Which brings me to the third point, which is meeting families where they are at and letting parents share their story. So I shared a little bit about what my father told me when I came out, which was there's a time and a place for everything, and then we just didn't discuss it for years. But part of what my father didn't have, and part of what would have been helpful for him, is to have someone who's not related to the family that he could speak to and just share, this is this is what's going on for me. This is where my concerns lie. This is where my fear lies. I'm afraid of someone hurting my child. I'm afraid of my child not being able to thrive or be autonomous or be able to support themselves in the future. I had maybe these expectations around what the trajectory of my child's life would be like and how I was setting them up for a better life than I had, right? So when we have all of these expectations kind of built into this, in the ways that we are caring for a young person, when those expectations change or shift or something falls out of alignment or we're afraid that they might have changed or shifted, then we don't really know where to go and how to support in those moments. So, as a healthcare provider, as a public health provider, one of the things we can do in engaging families in supporting their trans and non binary children is meeting the family where they're at, meeting the individual folks in the family where they're at, if they're struggling with understanding, if they're struggling with acceptance, if they're struggling with this fear, and also letting parents share their story of who, like, what it was like raising this young person. What are some of the things they love about this young person? What are some of the things that they have concerns or fears around with this young person? What expectations did they have set up for this young person? Or how did they see this young person growing and thriving that them coming out might have made this shifted this for them, right? So letting parents share their story can be a powerful and transformative way to support them in growing and learning to accept and re-engage with their young person in new ways, with their child in new ways. And part of that, I think, is giving families respectful language to refer to their child. So you might be working with a family, you might be supporting a family or trying to engage a family around supporting their trans or non-binary children, and they just don't have the language to be affirming. They might not know that continually referring to the young person by the name that they previously went by is actually not an affirming behavior, right? Or saying things like, sorry, you'll always be my daughter and I'll always see you as my daughter no matter what, is actually not affirming to the person's identity. And so that can be, and it can be difficult. So it goes part and parcel with letting parents share their story, but also giving parents and families respectful language to refer to their child. So it could be affirming pronouns, affirming name. If you're working with families who are not to that point yet, so let's say I'm working with a family or trying to engage a family in supporting their trans or non-binary child, and they're just like, I'm never going to use those pronouns with the child. The way that I can support is, okay, well, I'm not comfortable using pronouns that the child doesn't use. So can I say your child instead? So moving to like a gender neutral place, again, trying to meet the family where they're at, or the parents where they're, or caregiver where they're at, and helping them to understand over time what this looks like. A lot of it is rapport building so that we are providing compassionate and dignified support to the family members so that they can provide compassionate and dignified support to their trans or non-binary child. And it takes a lot of energy and a lot of me putting aside my own emotions around like, no, you just need to get on board. If I bulldoze in those ways and say like, you're not being respectful, you're not being affirming if you're refusing to use these pronouns, then I'm also pushing the parent or family away from being able to hear the larger message, which is, let's talk about your child's life. Let's talk about that you love your child and you want your child to succeed and to thrive and to grow and to be healthy. So let's refocus on those pieces. So it might be shifting more to a gender neutral language in the interim while you're helping the family to come to an understanding around what it means to be affirming and why affirming behaviors are not just helpful, but they are protective for the health and well-being and quality of life for their child as well. Which brings me to my final point, which is that part of our role as healthcare providers and public health providers, when we are working with families and engaging families in supporting their trans and non-binary children, is helping to educate on how rejecting behaviors and accepting behaviors impact a child's health. So rejecting behaviors, and I linked already the SAMHSA report in the comments below. So if you haven't had a chance to check it out, please do check it out. Also, the Trevor Project releases a mental health report every year from national data, a national survey that they conduct. That also shows how rejecting and accepting behaviors impact the mental health and well-being of LGBT youth, but also specifically trans and non-binary youth. So these are some additional resources that are available to you to help with this education. But when we educate on the fact that rejecting behaviors increase mental health challenges, they increase psychological distress, that rejecting behaviors also increase instability, not only instability within the home, but also increased likelihood of running away from home, of avoiding or keeping from parents or from families when challenges are arising. They reduce uh, support seeking behaviors as well for young people, and ultimately then impact their health and well-being. And when we educate and show that accepting behaviors not only neutralize that negative impact, but also increase mental health stability, reduce psychological distress, reduce instability in the home or home leaving behaviors, reduce the instability that we see later in life as well, then we can help families understand how shifting from behaviors that are rejecting to accepting behaviors, even if the family is still struggling with understanding, can be protective and bring us back to that first and second point, which is that families love their children and want them to have a good life. So if we are assuming that families love their children and want them to have a good life, then we can help give families respectful language. We can help educate on rejecting behaviors and accepting behaviors and how they impact a child's health. We can create space for parents to share their story and share where they are at and what's going on for them, and also meeting those families where they're at. And ultimately, we then take that strengths-based approach of treating families as an ally in the health and well-being of their children. So these are the tips that I have for you. I highly encourage, if you are working in an environment where you are supporting families, especially families of trans and non-binary children, please check out the link in the comments below. Please let me know other strategies or other ways that you have helped to support trans and non-binary children when you're working with families or you're trying to engage families in supporting trans and non-binary children. I'd love to hear about those in the comments. I know that there are lots of folks who are doing amazing work in supporting whole families, and I think if from what I have learned around protective factors in my background in public health and in healthcare, the more that we can support other supports around trans and non-binary young people and around trans and non-binary people in general, the more supports that are present in a person's life, the stronger likelihood of positive health outcomes and the weaker likelihood of negative health outcomes. So I think that this is a way that we can holistically support a family and bring more supports into a trans or non-binary young person's life. I'd love to hear about it in the comments. Again, my name is Miss Jai. I use she, her, and he, him pronouns. I am a subject matter expert in trans and non-binary health and well-being, and I help healthcare and public health agencies learn how to better serve trans and non-binary communities, people, and patients through capacity building training, technical assistance, and organizational strategizing. I'm also really excited. We just launched our first course, which is the Foundations of Trans and Non-Binary Patient Care, which is now available through our website. I'm also going to go live later today and talk a little bit more about that. So if that's something that you're interested in, if you're working in a healthcare environment, if you're a healthcare provider, please join me this afternoon, and I'll tell you a little bit more about that course and go a little bit more in depth around that. But until next time, thank you for joining Ask Miss Jai Live. Please like and subscribe if you are on YouTube. If you're checking this out on LinkedIn or on Instagram, we have 4 seasons on YouTube of a variety of topics. So please check out our YouTube channel at Ask Miss Jai. And until next time, thank you for investing in the health and well-being of trans and non-binary communities, and take care of yourselves.